Rahim. This quick talk is about public health informatics in continuation of our discussion in digital health. So we will focus on what information are needed for public health. These are the learning objectives of this session. Let's start with the vision of the Institute of Medicine. The Institute of Medicine in the United States sets three main roles for public health officials. Let's say you are involved in high level administrative position in the Ministry of Health in regard to population health and public health. What is your role? What are you supposed to do on the national level? From where do you start? You have health services, you have population, you have different regions with different settings, different health issues, different diseases. From where do you start? So public health considers the population altogether to make the best use of resources to improve health of people. So according to this, there are three main roles of public health. The first role is assessment of population health. So you as an administrative on a higher level in the Ministry of Health, overseeing the whole nation, you are first supposed to do some assessment of the population health. What regions you have in the country that have health issues. By the way, health issue does not only mean diseases. It could be sanitation, living status, housing, conditions of weather-related area where it is cold, freezing in winters, how people are living, and so on. The sources of water, sources of food, any contamination. All of this is within the scope of public health. So you need to assess the population health. Second, you need to make policies in regard to what you have came up after your assessment. So upon your assessment, you discovered that you have some regions with health issues, so you need to make some policies to deal with these issues. The third role of public health is assurance of resource availability. So not only policies are written and stated rules, but how really do you reach to the population is by going into more details to assure whether the facilities, the resources are available in each region. So this is a really high level scope of the public health. Let's go into some of the examples, some shared services that can be looked at in each of this on each of these roles. So in the assessment, we will speak quickly about, for example, in assessment, what do you do to assess the population health? You can do screening, registry, surveillance. These are some of examples. I will speak a few words in a minute about these services. In policy development, you need to have strategic planning, you need to have health improvement planning, advise and consult, health promotion. So these are services that you should organize or at least promote or help support to ensure your role as policy maker, policy development. In the assurance, for example, you need certification, training, referral, eligibility, enrollment, etc. So these are services that, as a public health organizer or administrative, you need to look at. Let's discuss them quickly. Few words on each of these services to give you an idea. Of course, our focus in health informatics is on what type of data you need to solve or to provide this service. So when we talk about assessment, in assessment you need remember or imagine again that you are a high level administrative person in charge who are overseeing the public health in the entire nation, in the entire country. So you need to do identification and demographics of your population. So you need to identify where is your population is distributed, where are the crowded area, how many people, population and demographics, age group, elderly, is there any certain region that you have in the country who has some different demographics, etc. So the focus from informatics point of view is to think what type of data do you need to collect, and how are you going to really collect and sort these data. One of the services of assessment is screening. Screening is for medical staff. I suppose screening is understandable. So you have some certain diseases that are relatively prevalent in the population, and you screen for them to treat them early on. For example, you screen for cancer, breast cancer, you screen for colon cancer, for example, you screen for cervical cancer, and so on. You screen also for other chronic diseases like diabetes, you screen for hypertension. These are prevalent diseases that screening is useful because the yield is high. The disease is prevalent, and when you apply screening, you will discover cases early on before the appearance of complication or advancement of diseases. So screening is one of the services or function that public health should oversee, organize, support, and oversee. Registries is another service. I am talking about registry on the national level, on the entire country. So, for example, cancer registry is a famous thing. Everyone who has cancer should be registered. So we have good analysis, we have accurate data to analyze, to know what diseases we are dealing with in our nation, in our country, in our population. Disease surveillance is a close term to screening, but surveillance is more broad and wide. Surveillance does not include only diseases. Surveillance include health issues. By definition, surveillance should be systematic, regular. It is not once or a random thing. Surveillance should be something systematic. You do it on regular basis, every month, every year, every week, and so on, depends on what you are looking for. Surveillance also include health and non-health issue. So sanitation and living status, water sources, etc. So it's part of the surveillance of diseases. Next, testing. As a public health, you should have services to test for common diseases. Conduct investigation and compliance review. This is another function to assess what's going on in your population. So there are, of course, more than this. This is just a list, a short list, not inclusive. There are other functions, but the point is back to assessment. As a public health, you need to assess your population. Our focus in our discussion here in informatics, what data you need to do screening, what data you need to do surveillance, what is the source, how do you get them, how do you get data, how do you store them, what type of analysis do you need, what reporting do you need, what part of these reports you need to publish publicly, and so on. So this is our focus. I'm highlighting the informatics side in public health here. The second role of public health is policy development. So again, imagine yourself as a high-level administrative person who's supposed, now you assist your population and you know that you have, for example, high prevalence of obesity, high prevalence of smoking, and you need to come up with policies to solve these health issues. So one of the services is health promotion, disease injury prevention. So you need to promote health. You need awareness about the issues in obesity, what are the risk of what diseases result from smoking, risk of ischemic heart disease, risk of cancer, etc. So this is a public health issue. Advice and consult, this is another part of the policy development. Emergency response planning, how do you plan emergency response? Suppose there is an epidemic or disease a communicable disease that is reported in one of the centers, hospitals, or regions. What emergency response do you have? You need a policy, you need guidelines for people to follow. What are the communicable diseases that are reportable that they should report, and how do they deal with these diseases? So these policies are coming from higher level on the nation level. Strategic planning is part of policy making, policy development. You need strategic planning, of course, in regard to health issues in the population. The third role of public health is assurance of availability. Are the resources available for your people, for the population? Part of the assurance is licensing and permit. You wouldn't let anyone practice medicine or medical practice without proper certification. So you need some kind of body or rules that make sure that whoever practice is certified. So you need licensing. Rules and regulation enforcement. You need to detect any breach in rules and regulation to enforce these rules. Care coordination. We talked a couple of times about the fragmentation of services. A patient may go to different hospitals to do exactly the same thing without any coordination between them. When the patient is referred from one center to another, the other center usually this is what happens most of the time. The other center repeats everything has been done already, that have been done already. So why? Because the care is not coordinated. Add to this that the referral system sometimes is not perfect, and patient might be lost in the referral system. So patient need to be referred to a tertiary center, and they lose the track, and they are not referred to the proper service. So this is part of the coordination. So this is a public health issue, although we know that I know it is one patient who has issue with referral, but this is a public health issue. Training and certification is another thing that public health should look at. Performance measure and outcomes. At the end of your service, what is the outcome? Are you still have do you still have in your population obesity and smoking? Is there any reduction? What are you doing to them? Do you have any measures that track and monitor what's going on in your population. So this is a public health issue. Governance, how do you make rules and regulation to govern the facilities and the resources? And lastly, system management. Again, this list is not comprehensive, but it gives you just an idea what type of data that we need for public health official to do their proper job, how they get these data, how do they store these data, what analysis is needed, what to be reported, and so on. We are in Saudi Arabia have a lot of challenges in public health, similar to other countries as well. Unique things might have some different requirements. So we are going through, in Saudi Arabia, we're going through transformation of healthcare model. This transformation is going on actually at the moment, and there are changes in the role of Ministry of Health. The simplest way I would say that the Ministry of Health used to be the provider of the service and the payer for the health services. Ministry of Health now is trying to divide these roles. Instead of being the provider and the payer, there should be two separate bodies or entities, one provider and one payer, so there is better not coordination, better follow-up, and the services that is needed is done, and the cost is clear, not hidden. We might speak more in our meeting about the new role of Ministry of Health. The need for health information organization. This statement, I would say that imagine an organization, an institution. What are the components in an organization? Usually, by definition, organization is the way the institution do things. So the policies, procedures, how people are dealing with each other, the culture of the organization. This is what is meant by usually the organization. So this is one of the components. Another component, you have facilities, you have buildings, land, equipment, machine. So in an organization, you have policies, procedure, people, then you have facilities, land, machines. In addition to this, I would highlight your attention to the information component. So to say it again in other term, there are three main components of organization. The first component is the facilities. The second component is the people and policies. The third component is the information. Now we look at information as a separate component within an organization. That's why in hospitals there is always designated department or administrative staff to deal with information. So information in itself is an important component within an organization that needs to be looked at separately. It is not separate from the work point of view, but we need to focus on it to consider it separate. What I'm trying to say, information is not something that is spontaneous. If we organize our work by policy, procedure, and facilities, everything is done correct. No, we need to consider the information as a component that we need to organize separately. In Saudi Arabia, the change in disease pattern with increase in age expectancy, life expectancy, increase in age group, We do see more chronic diseases, more people with diabetes, hypertension, complication of chronic diseases, with better medical care. There is more long period of follow-up for patients. Um, uh, 50 years ago, people might die from simple infections, but now we have treatment for infection. This is very simple example. I would say ICU care. People used to die because there is no good ICU care. Now we do have ICU care, so people live longer. So we need to deal with diseases in the aging population. Especially in Saudi Arabia, there is high expectation of the public, high expectation from the health sector. People expect to have excellent medical service available anytime, free of charge, all specialties. So the expectations are really high. So this is a challenge for public health. In addition, unique setting in mass gathering like Hajj Umrah. This is unique situation that we have in our country. Millions of people visit the country, and they are aggregated in one place at the same time. So this is a challenge to public health. Looking at the data, I always highlight the data aspect when we speak about informatics. From the left side, uh, um, you might have personal data, medical data, social data, environmental data. These are mostly unstructured data. What we need to work on is to make them structured data, organize these data to be integrated in an integrated approach. Then we can provide medical care like prevention, diagnosis, management, and from public health point of view, these data need to we need to cross these data for the purpose of assessment of the population, policy making of healthcare, and assurance of resources. Public health is no longer confined to your local region, but an endless wire of connection. If an outbreak occurs in one state, another state may be able to search for familiar symptoms amongst their patient base and in hope of halting the spread of an outbreak. So now using informatics will help in confining outbreaks, for example. I don't know if anyone familiar with Hisn. Hisn is one of the systems that we have in the Ministry of Health to capture, record, store communicable diseases. And this is this came in the news a couple of years ago in regard to the start of this electronic system for communicable diseases. You may actually check on YouTube and the Ministry of Health website. You may check the site to know more about Hisn. Okay, let's get back to reality. In reality, most diseases are dealt with physicians and healthcare providers. The public health personnel might be far away from the information needed. So usually or traditionally, there is complete separation between the primary care and the public health, as they are traditionally two different specialties. This is one paper that highlight this problem, this issue, and discuss that we need really to integrate the practice of medicine, especially primary care, with the public health information to make them one. And they describe a spectrum from the left, complete isolation between primary care and public health, Then we move to a higher level of integration with mutual awareness, then cooperation, collaboration, partnership, and the highest level is merger of information. So whatever the primary care physician, whatever information the primary care has, public health can reach to this information. So this is high level of integration between information. At the moment, I would ask you to imagine what type of data that we need to integrate between primary care and public health, and how these data are integrated, what system we need to work on to make public health and primary care and other medical specialties merge together. We do have in our country Hajj and Umrah. It is mass gathering. There are certain diseases that prevalent in mass gathering. We have a lot of environmental issues and risk factors other than the obvious diseases. Other environmental issues, sanitation, transportation, crowding, and there is a lot of risk injuries in summer, heat strokes. So there are special issues that are related to Hajj and Umrah. These are all really or should be looked at from population health point of view, in addition to other health issues. With this, I will stop here. This is the assigned task. You might read it and try to come up with ideas for this assigned task. Thank you very much.